Welcome to this training session on the Code of Conduct for Healthcare Support Workers and Adult Social Care Workers. This course is designed to guide you through the essential standards of professionalism, compassion, and safe care. By following these guidelines, you will not only enhance your own practice but also ensure that the individuals you support receive high-quality care that upholds their dignity, rights, and well-being. Let's explore the key principles that set the foundation for excellence in care. Thanks to VARD Training Academy and the CPD Standards Office. As a healthcare support worker or adult social care worker, your role is crucial in delivering high-quality care and support. This code of conduct is designed to guide you in providing compassionate and safe care to those you support. By adhering to these principles, you can be confident that your practice meets the highest standards. It also empowers you to address and challenge situations where others may not be upholding these values, ensuring that the care environment remains respectful and dignified for everyone involved. As a healthcare support worker or adult social care worker in England, adhering to the Code of Conduct is crucial. The code outlines the standards and behaviour expected from care workers, ensuring they provide safe, compassionate, and dignified care. Key principles include respect and dignity, treating people with respect, valuing their diversity, and promoting their rights and dignity. Compassion, providing care that is person-centered, empathetic, and tailored to individual needs. Professionalism and integrity, upholding high standards in your role, being honest, and maintaining professional boundaries. Confidentiality, protecting the privacy and confidentiality of the individuals you support. Safety and quality, delivering care and support that is safe, effective, and of high quality. This commitment helps build trust with those you care for and ensures that you consistently provide high-quality, ethical support. This code is based on the principles of protecting the public by promoting best practices. It will ensure that you are working to standard, providing high-quality, compassionate healthcare, care, and support. The code describes the standards of conduct, behavior, and attitude that the public and people who use health and care services should expect. This means that the code outlines specific expectations for how healthcare professionals should act. It sets a benchmark for professionalism, ensuring that everyone receiving care can expect respectful, ethical, and competent service. You are responsible for, and have a duty of care to ensure that your conduct does not fall below the standards detailed in the code. As a healthcare provider, it is your responsibility to adhere to these established standards. This duty of care means that you must actively maintain these standards in your work, ensuring that your actions and decisions reflect the guidelines set out in the code. Nothing that you do, or omit to do, should harm the safety and well-being of people who use health and care services, and the public. Your actions and inactions must be carefully considered to prevent any negative impact on patient safety and overall well-being. This principle emphasizes the importance of both proactive care and avoidance of any lapses that could potentially harm individuals or undermine public trust. This code of conduct applies to healthcare support workers, including assistant practitioners, in England who have a patient-facing role, where no other specific code applies to them. Adult social care workers in England, including those working independently, e.g., as a personal assistant, for residential care providers, or in supported living, day support, or domiciliary care settings. Please note, the code does not apply to social work assistants. By following this code, you can be sure of the standards you are expected to meet. You will have a clear understanding of the expectations and requirements for your role, helping you to consistently meet professional standards. Can know whether you are working to these standards, or if you need to change the way you are working. The code provides a framework for self-assessment, allowing you to evaluate your performance and identify if adjustments are needed to align with the expected standards. Can identify areas for continuing professional development. It helps you recognize where further training or improvement may be necessary to enhance your skills and effectiveness in your role. Can fulfill the requirements of your role, behave correctly, and do the right thing at all times. Adhering to the code ensures that you meet your role's requirements, act appropriately, and make ethical decisions, which is essential for protecting those who use health and care services, the public, and others from harm. The code helps the public and those who use health and care services to understand what standards they can expect of healthcare support workers and adult social care workers. It provides transparency about the level of care and professionalism that individuals should receive, helping to build trust between service users and care providers. The code aims to give people who use health and care services the confidence that they will be treated with dignity, respect, and compassion at all times. By adhering to these standards, you contribute to creating a supportive environment where individuals feel valued and cared for, fostering positive experiences and outcomes for those who rely on your services. The code helps employers to understand what standards they should expect of healthcare support workers and adult social care workers. It provides employers with a clear set of expectations, ensuring that they can effectively evaluate the performance and professionalism of their staff. If there are people who do not meet these standards, it will help to identify them and their support and training needs. The code assists in recognizing gaps in performance or areas where additional support and training are required, facilitating targeted interventions to help staff meet the required standards and improve their practice. Code of Conduct Number 1. Be accountable, take responsibility for your actions or omissions. Ensure you can justify your decisions and reflect on their impact on service users and the public. Be honest about your skills and limits. Only perform or delegate tasks that you are competent in and that are specified in your job description. Ensure that your behavior and appearance reflect the standards expected in health and social care work, upholding your suitability for the role. Request guidance if you are unsure about any aspect of your work or task delivery. This helps ensure that you perform tasks correctly and safely. Notify your supervisor of any issues affecting your job performance or safety. Report if you lack competence in specific tasks, so that appropriate support can be provided. Maintain professional boundaries with service users, carers, and colleagues to ensure clear and respectful relationships. Do not accept loans, gifts, or benefits from those you support or the close contacts, to prevent any conflicts of interest or perception of impropriety. Comply with your employer's procedures and policies to ensure consistent and safe practices in your work environment. Report any actions or omissions that compromise safety or care. Use whistleblowing procedures for serious concerns to ensure that issues are addressed appropriately. Code of Conduct Number 2. Promote and uphold the privacy, dignity, rights, health and well-being of people who use health and care services and their carers at all times. Prioritize the well-being and best interests of those using health and care services. Make decisions that benefit them and support their needs. Always show respect and compassion towards individuals. Approach each person with dignity, kindness, and understanding. Support individuals in making decisions about their care. Ensure they have control over their own care and support, aligning with their preferences and needs. Encourage individuals to take charge of their own care and make informed choices. Support their ability to perform tasks and manage their own health as much as possible. Ensure you have clear and informed consent before providing care. Respect any refusals of care and ensure consent is properly documented and understood. Maintain the confidentiality and dignity of service users. Protect their personal information and respect their privacy in all interactions. Notify appropriate personnel of significant changes in a service user's needs or progress, following established procedures to ensure timely and appropriate responses. Take all necessary precautions to prevent harm. Never engage in or tolerate any form of abuse or exploitation. Report any dangerous, abusive, or unethical behavior. Ensure that such conduct is addressed to maintain a safe and respectful environment. Take complaints seriously and address them promptly. Ensure that any concerns are reported to senior staff and handled according to your organization's procedures. Code of Conduct Number 3. Acknowledge your contribution, recognize and appreciate your essential role within the team. Understand that your contributions are crucial to the team's success and the quality of care provided. Respect roles and expertise. Value and respect the roles and expertise of your colleagues, both within your team and from other agencies. Collaborate effectively, acknowledging their skills and knowledge. Promote open cooperation. Foster a cooperative work environment by engaging openly with colleagues from various disciplines and agencies. Treat everyone with respect to build strong, collaborative relationships. Engage respectfully with service users, interact with individuals using health and care services, and their families or carers, in a respectful and open manner. Ensure that all communication and interactions are conducted with dignity and empathy. Honor commitments. Be dependable and trustworthy in meeting your work commitments and agreements. Follow through on promises and responsibilities to maintain reliability and trust. Encourage high-quality care. Actively support and advocate for the delivery of high-quality health care, and support. Strive to enhance and maintain the standards of care provided to service users. Code of Conduct Number 4. Communicate in an open and effective way to promote the health, safety and well-being of people who use health and care services and their carers. Communicate openly, accurately, and effectively with people using health and care services and their carers. Ensure that all communications are confidential and maintain the dignity and privacy of the individuals involved. Engage in effective communication with your colleagues and seek their input when needed. Collaboration and consultation are essential for delivering comprehensive and well-coordinated care. Discuss and clearly explain care procedures or any relevant information with the person receiving care. Ensure that you only proceed with care or procedures after obtaining valid consent from them. Keep clear and accurate records of the care provided. Report any concerns or significant changes to a senior staff member promptly to ensure proper follow-up and continuity of care. Be aware of the extent and boundaries of your role, knowledge, and competence when communicating with service users, carers, and colleagues. Understand and acknowledge when to seek additional support or refer to others with more expertise. Code of Conduct Number 5. Respect people's right to confidentiality. Treat all information about people who use health and care services, as well as their carers, with strict confidentiality. This means keeping personal and sensitive information secure and not sharing it without proper authorization. Discuss or disclose information about people who use health and care services and their carers only in accordance with relevant legislation and agreed procedures. Ensure that any sharing of information is done legally and in line with established protocols. Always seek advice from a senior member of staff regarding any concerns or issues related to the information you handle. This ensures that you manage information appropriately and in compliance with legal and organizational standards. Consult with a senior member of staff about any issues concerning the disclosure of information. This includes discussing any uncertainties or potential breaches to ensure proper handling and adherence to confidentiality guidelines. Code of Conduct Number 6. Strive to improve the quality of healthcare, care and support through continuing professional development. Stay up to date with all statutory and mandatory training requirements, working with your supervisor to ensure that you meet these obligations and remain compliant with regulations and standards. Actively participate in ongoing professional development activities to acquire and maintain the skills and knowledge necessary for your role. This helps you stay current with best practices and advances in your field. Complete training and education that are focused on developing specific competencies required for your role. Follow the procedures agreed upon with your employer to ensure you are adequately prepared for your responsibilities. Collaborate with your supervisor and, if available, a mentor to improve the quality and safety of the care you provide. Adhere to agreed-upon practices and continuously seek ways to enhance care delivery. Maintain a detailed and up-to-date record of all your training and professional development activities. This documentation helps track your progress and demonstrate your commitment to maintaining your skills. Contribute to the learning and professional growth of your colleagues as appropriate. Share your knowledge and experience to help enhance the overall competence and effectiveness of the team. Code of Conduct Number 7. Uphold and promote equality, diversity and inclusion being of people who use health and care services and their carers. Respect individuality and diversity. Show respect for the individuality and diversity of people using health and care services, their carers, and your colleagues. This involves valuing their unique backgrounds, perspectives, and cultural differences. Reject discrimination. Do not engage in or tolerate any form of discrimination against those who use health and care services, their carers, or your colleagues. Ensure that all interactions and decisions are free from bias and prejudice. Promote equality and inclusion. Actively work to promote equal opportunities and inclusion for everyone involved. Ensure that people using health and care services and their carers are treated fairly and have access to the same opportunities and support. Report concerns. Report any issues related to equality, diversity, and inclusion to a senior member of staff as soon as they arise. This helps ensure that any problems are addressed promptly and appropriately. This code of conduct has been adapted from original work developed by NHS Education Scotland, NHS Scotland, and the Scottish Government. For reference and further details, please consult the following sources: NHS Wales Code, original work by NHS Education Scotland and Scottish Government, Skills for Health Code of Conduct. This adaptation aims to align with the principles outlined in these sources while being tailored to meet the specific needs and context of our organisation. This course, developed by Pastor Adi Makondwa, has been crafted with a strong commitment to professional excellence. We are pleased to announce that it has received accreditation from the CPD Standards Office as part of the New to Care for UK care and support workers, ensuring it meets the highest standards of continuing professional development. We extend our heartfelt thanks to all participants for your dedication and engagement throughout this course. Your commitment to learning and professional growth is crucial in upholding the standards of care and improving service delivery. We encourage both current professionals and those aspiring to join the UK care workforce to follow the code of conduct outlined in this course. Adhering to these standards will not only enhance your professional practice but also significantly contribute to the delivery of high-quality care. To complete the course and receive your certificate of completion, please ensure you take and pass the quiz at the end. This final step is essential for verifying your understanding and obtaining your certification. Thank you once again for your participation. We wish you continued success in your professional journey.